Good morning, everyone. How's everybody doing? Great. So this month, as you can see, this is still May, so I'm still a little bit behind, but we'll catch up. This one is about strength, osteoarthritis, and chronic pain management. I'm going to take this down so I can breathe a little bit. So it starts off by saying, why is strength important? I think every one of us know and understand that strength is important for us, but just something to think about. And I know we've used this saying before, but leg strength, not your diagnosis, not cholesterol level, not age, not medications, not any of the usual measurements, but leg strength was the single most powerful indicator as to whether a person was going to enter a nursing home. Okay, what they mean by nursing home is down in Willowbrook Court, all right? And that was by Dr. Mary Tonetti. So Dr. Tonetti developed one of our balance screening tools that we used to use. It's a little bit older now, and it's been proven that there's some better ones, but she was very good at designing and researching these things. So that's really powerful to say that strength is a powerful indicator, especially in your legs. All right, but think about it. They say gait speed is a predictor of mortality. All right, the slower you move, the faster you're going to die. So think about it. If you're in a wheelchair, well, that's pretty obvious. You're not moving, you don't have much leg strength, you're not walking, you don't have a gait speed. You're obviously going to die faster. All right, so it's just something to think about. I thought it was interesting. All right, so let's talk a little bit more about strength. All right, so adults over the age of 50, all right, so think about that as we're all sitting here, naturally lose 1% of their muscle mass per year. All right, now this is also, of course, before you say your strength training, okay, but think about that. All right, if strengthening exercises are neglected, this equates to a loss of 1 to 3% of strength loss per year. All right, so let's say you're 70. All right, so 50 to 70 is 20 years, correct? So that's anywhere from 20 to 60% of your strength loss. Those are massive numbers. Oh, they used 80. I was close. All right, and unfortunately, we have more bad news. Okay, there's different types of muscle fibers. I don't know if anybody's heard of quick muscle fibers or fast acting, and then you have your slow muscle fibers that do different things. Well, these muscles that you start to lose, the fibers, are the quick acting ones. That's why we all get a little slower as we get older, okay? But those quick acting ones are the ones that help us to stay balanced and keep us from falling, all right? So it's no wonder why, as we get older, we tend to fall more. All right, so some of the benefits of strength training, all right? It improves your muscle mass, okay? Improves your muscle function. So we need muscles to move things, right? So I tell people all the time when they talk about swelling, oh, my legs are swollen. Well, you know what? Think about it. You got this much space in your leg. This is how big your skin is, all right? Let's say your muscle's like this. All right, it's swollen, your leg's puffed out, stretching that skin. When you contract that muscle, it gets bigger, so you only have so much space in there. So what happens to that fluid? It gets pushed out. All right, so that's something that I thought was interesting. So it improves your edema, improves that stuff, improves your endurance. Okay, you got to be able to move. Okay, it reduces disability. Okay, let's see, it maintains bone loss. All right. So what do your bones need to stay strong? They need pressure. They need weight. All right? It's like making a diamond. Diamond or coal needs pressure to build that. Improves quality of gait and gait speed, right? Not everybody likes walking with those rollators or those walkers. So staying strong keeps you from having to use that. Reduces fall risk. And lastly, decreases pain. I don't think anybody likes to be in pain, right? So the stronger your muscles are, the more they can support your joints. Even with arthritis, people talk about, well, I have arthritis, I shouldn't move. It's not true. If you strengthen the muscles around where your joint is, okay, it helps your joint to move better. All right, so we have our knee, for instance. Okay, I think I can get in this video. All right, we have all these muscles around it. If your knee starts breaking down and has arthritis in it, these muscles around it support that knee joint. All right, so I can move better if I have stronger muscles. They're bigger. They can move my knee in the correct way. Okay, because with every joint, there's a correct and an incorrect way to move it. You see people that, like this, what we call knock-kneed, right? Or bow-kneed, bow-legged, okay? Those joints are incorrect, okay? So we have to teach those muscles how to work correctly. Oh, do you know if you are strong enough? So what is strong enough? All right, so what we ask everybody to do is participate in a Thrive screen. Those screens are made to show you where you are at. We look at what we call normal data, usually in your age group. Usually it's about 5 years. Like it'll do like 80 to 85, and it'll say, out of the United States, most people can do 10 stands from a seated position without using their hands. Okay? Well, where do you line up in that? Maybe you can do 7. Doesn't mean that you're too weak. It doesn't mean that, it just means that that's where you fall in your age category. Maybe you say, hey, you know, I do feel a little weak sometimes. It does get a little harder, all right? So those things we look at. So sit to stand, grip strength. Grip strength is another really powerful indicator of your overall strength, okay? Most people in between 30 and 50 pounds is pretty good, all right? And lastly is your gait speed. We talked about gait speed a little bit earlier, but gait speed is something important because think about if you're in independent living. Can you walk across the street while there's a car coming? You know, all these things are important to think about. All right, if you're experiencing joint pain, muscle fatigue, or developing poor posture, consult your PT or your OT. These could be signs that you could need a Thrive prescription. So what we try to do in our Thrive prescription, I know some of you know these things, but there's 5 components. Now let me see if I can remember. Flexibility, balance, strength, cardiovascular or your endurance, and your mind strength. So we figured out that those 5 components are the most important things to you. All right? So what we do when we do a Thrive prescription with somebody is we set you up with something for each of those categories, because that is what's going to keep you as independent as possible. Okay? And those are the 5 main core things. We want you to do something with flexibility. Everybody needs to stretch, even myself. Everybody needs to strengthen, right? Everybody needs to work on balance. Cardiovascular, everybody needs to get their endurance up so they can stay mobile. And everybody needs to work on their mind, whether you're sharp or you're not. Okay? Because your mind is a muscle too. It needs that strength and that challenge. All right, so now we're going to go down to arthritis. So we're going to talk about what is it, why does it hurt, and what can be done about it. So living with arthritis, it doesn't have to be like this. You can see he's pretty sad, right? He's not moving much, and he's got his cane there. And then you see 2 active people, looks like going on a walk. So it's still possible to enjoy things. All right, so this is a picture. I really like this picture. It's a good one. So let's see if this pointer works. Oh, you can't really see it much. Can you guys see that?
I can kind of.
All right. So this is a side picture of your knee joint. Okay, you have your quadricep tendon coming down here. Okay. You have your femur and your tibia. Okay, this is what the normal joint looks like. Look at all that fluid in there. Okay, you can see the cartilage or your meniscus. Okay, you can see your joint capsules around. They look pretty healthy, don't they? So when that knee joint moves, okay, the bones don't have to rub. They move, that fluid moves around with it. Everything works great. Now, if you look in that second picture there, you see how those bones are rubbing together? That's the pain you feel with arthritis. And a lot of times, I tell people, I use my knuckles as an example, okay? Because depending on how you walk, every single one of us walks differently, okay? Some people have a little bit of hyperextension where your knee goes back further, okay? Some people don't have good quad strength, so you'll see them kind of kick their legs out when they walk. There's different pieces. But the point is, when your bones move, they all move differently, okay? So with arthritis, sometimes it ends up looking like this, okay? Maybe you're so used to walking one way, now your knee looks like this. So when you go to move, and let's say you move a little differently, ooh, those slip. that hurts, and it hurts bad. And then people are like, well, I shouldn't walk anymore. I can't do that. But that's not true. If we strengthen the muscles around it, it supports that knee joint. Okay? If you have, let's say, all right, you have your knee here, you have muscles on top of it, you have muscles below it. If I strengthen these muscles on top, it's going to pull everything up a little bit. So if I walk correctly, okay, my kneecap should move a certain way. All right? So all these pieces come together to make it easier to move. So that's why it's important to keep moving with arthritis. But this is a great picture to kind of show you what happens. You can see that the cartilage is all worn down. You can see that there's no more fluid in between. Okay? There's still some fluid on the sides. And you can see that it's starting to get a little rigid on the tops of the bones here. Okay? And they rub together, and that hurts. It causes a lot of pain. You'll hear clicking noises, popping noises, a lot of people in their shoulders. Okay? Knees and shoulders are probably your most common parts that you get arthritis, and your hips, of course. Okay? So here we go. What causes it? Age. All right, think about it. I weigh 200 pounds, and every day I'm putting all that weight on my knees. Okay? Let's say I run. All right? Now I'm putting extra force on my knee joint every single day. Okay? Eventually it's going to wear down. It's like a rock in water. Okay? Starts off nice and sharp and edges, but after a while of that water running over it starts to become smooth. Okay? Repetitive use. So every day we have to walk, right? Can't stop that. Genetics. All right? Some people are predisposed to these things. All right? Secondary things. Obesity, repeated trauma or surgery. Okay? Congenital abnormalities, gout, rheumatoid arthritis, diabetes, spinal deformities, and other hormone disorders. So all these things can change the way your bones grow, the way bones wear. So we have to be careful and just, know what our body is like. And the best person to know that is you. All right? So it says it strikes in the major joints. So there it's got a picture up here of your shoulder, and it says clicking or cracking sounds. Does anybody have clicking or cracking sounds when they lift their arm up? Yes. Let's see. It says asymmetry. It says affects the joint on one side and not the other. Slowness of onset. Minor swelling. A lot in your wrist. You'll get some swelling with arthritis. Stiffness in your elbows. Pain in the joints. Hips, hands, and knees are most common. Bone spurs. I see a lot of bone spurs in your spine. Does anybody, that's where a lot occur because, think about our spine. It's still weight bearing when I'm standing. We twist and turn. Your spine does all kinds of movements. Everything seems to wear down pretty quickly. Reduced flexibility, hard to bend down or climb stairs. So these are some of the signs that you can look at and say, all right, well, maybe I have some arthritis going on. All right, this is another good picture. I like this one too. So it really shows on an x-ray your knee joint. Okay, you see how that's nice and formed there? There's some clear space in between. And then here, there's still some space over here. But look at this side. There's nothing. So to me, this person walks a little differently. Okay, because it wore a little different. Okay, so that's just something to watch for. And then here we go. Here's our spine. Here's your bone spurs. Okay, there's your normal disc, your normal vertebrae, and there's one that's starting to wear down. And as we go down further, you see your disc has worn down, or your cartilage there even more. That's really painful. Spinal arthritis, okay? Think about it. Everything's in there. All your nerve endings, okay, are coming out. You can get pain anywhere, especially your neck. That's a really bothersome one. And that's why we do those tests when we do our Thrive screen for how far your neck is forward, because that tells us, okay, are you at risk for any bone spurs or narrow discs or any herniations? All these pieces affect it. All right, so treatment and care. What do? You can see a picture of their knee there. So we're going to protect your joints. And how do we do that? We strengthen the muscles around it. Okay? Medication and lifestyle changes. Sometimes it does. Sometimes we have to say, hey, look, you're walking on pavement every day. You're putting a lot of wear and tear, or you're running on pavement every day. Might not be the smartest thing for you. Okay? Sometimes we say, hey, let's get some better shoes. Somebody once told me the two most important things are shoes and a bed. If you're not on your feet, you're on your back, right? So when it comes to shoes, you have to make sure you're getting the right shoes for you. And there are a lot of places around here that do, they'll do like scans of your feet. If you're a runner, they do all kinds of different things. Injections. Injections can help by putting fluid into there to give your joint a little bit more lubrication. Every single one of your joints has synovial fluid in there, okay? And that helps the joint to move, okay? So your bones don't grind together, so everything moves well. Joint replacement surgeries, I think everybody knows. Hip replacements, now they do shoulders and knees and anything you can think of, they can do, all right? So joint fusions, a lot of times you see this in the spine. They'll fuse two joints together. Let's say your disc is gone or you have a fracture in there. They'll fuse those two together so they move synchronously together. Okay, so it reduces some of the pain. Steroid injections. All right, so what can you do to protect your joints? Physical activity, of course, right? Stretching, strengthening, aerobics. And this is why when I first got out of school, I went into aquatics. I did pool therapy straight out of school because it's so easy for some people, okay? Because you're still weight bearing. It's less, but you're still moving and you have the ability to move a little bit better. And I'll tell you what, I can give you any exercise that will give you a workout in the pool too. All right? So what else? Braces and adaptive equipment. Assistive devices. So some of those things eventually we have to do. We don't ever like to do it. I actually was reading a study about a week ago, and it said a lot of people, the first thing they do is they grab an assistive device, but they don't need it. And what happens is it changes how your posture, and it changes your gait pattern. So I always tell people, if you're thinking about it, let us know first. Because sometimes we could say, hey, you just have some weak quadriceps. We can fix that. It's easy. Now, the other thing that people often forget is every muscle has two movements. Okay? What do your quads do? Okay? They extend the knee, so they help me stand up. But they also help me to sit down slowly. Okay? So that's two movements. So in order for me to sit down slowly, my quads are contracting. They have to control that movement going down, okay? So what I tend to see a lot is people lack that movement. And it's not from lack of strength. Well, it is from lack of strength, but it's a different kind of strength. Anybody can stand up really quick, but can you come down really slow? So there's different pieces to every single muscle group. So it's important to look at those different things. And lastly, it says contact your AXE rehabilitation professionals. That's what we are trained to do. This is what we do every single day. We know a lot about it, okay? So I tell people all the time, if you just have a question, call and ask. We'll tell you what the best way to get, if you need something and you say, hey, look, I'm just having a trouble getting up from the side of the bed. Okay, well, let's think about it. Let's look at the different pieces. Is it higher? Is it lower? Is it, what's going on? And there's always a solution. All right, so additional treatments that can be beneficial. Lose weight, okay? The more weight we carry, the more pressure there is on our joints. Medications to reduce pain and inflammation, muscle relaxants. Sometimes I tell people, I know there's a lot of people out there, including myself, I don't like to ever take any kind of pain medicine. But at some point, it gets to the point where I can't help you unless you have reduced pain first. Especially with like knee replacements, hip replacements. You went through a major operation. And I tell people, look, if your doctor's prescribing it and recommending it, sometimes it is in your best interest to take it for a little while till we get to a certain point. Okay, because I have got to be able to move your leg, and if I can't because you're screaming in pain, we're at a lose-lose situation. So think about that. And I know nobody wants to take pain medicine or different things, but sometimes it's necessary to get through the beginning. Natural remedies, supplements, glucosamine, and chondroitin are popular. Wow. Acupuncture, massage. Everybody loves massage. That's great. Meditation, Reiki, Tai Chi. Hot and cold modalities. We use hot and cold. We use electric stim. We don't have cold laser. Sometimes there's certain clinics that will use that. Relaxation techniques. Sometimes people are just so stressed that you carry it in different places. So just being able to relax helps a lot. And we've actually have been doing a lot of this with certain people that come and see us, just because, you tend to tense up. Okay, when you're in pain, your first instinct is to guard. Okay, so what do you do when you guard? You're tense, you're stressed because it hurts, but you can't relax because you're stressed because it hurts. It's a lose-lose. So the first thing sometimes is just saying, hey, it's going to be okay. Let's practice some relaxation, put on some calming music, and that kind of stuff. So I think this goes into our next section. All right, so surgeries. Okay, we all know there's joint replacements. All right, hip, knees are the common ones. I've seen finger, I've seen foot joint replacements, all kinds of things. All right, arthroscopic. Usually they take and go make 1 or 2 incisions, take a little machine, go in there, clean things up, and you should be good on your way. All right, ostomy in younger individuals by cutting out pieces of the bone for weight-bearing distribution, different things like that. Joint fusion is more, like I said, in your spine, where they'll fuse bones together. All right, so although pain may be a normal symptom of arthritis, it is not a normal part of aging. Nobody should ever be in pain. That's not normal. Okay? Pain is a response of our body to something that's hurting. We have to fix it. Okay? So it's not normal. So at ACTS, we have access to a wide range of supportive services. All right? We have a nurse practitioner here. Laura's great. Love her. Okay? We have a program designed for pain management. Okay? A lot of that program is based on relaxation techniques. Okay? In different ways. We use different treatments. We do a lot of home remedies just for you to say, oh, there's different options for me. Because trust me, not one thing works for everybody. If it did, my job would be very easy. Very, very easy. Okay? We have fitness programs. Jonathan does a lot of classes. Okay? Classes, equipment, education. We have our life engagement coordinators that have different programs for people to engage in, walking trails, landscapes throughout our community. Okay, so this goes into talk about our chronic pain program. Okay, it's specifically designed and tailored for ACTS residents to keep everybody thriving. Okay, so what is it? Okay, so it's an 8-week program. So what we do, usually you're on our caseload too. So let's say we do 8 weeks. Sometimes if you say, all right, this is what I have, pain in my knee. Okay, come to our pain management program. What we do is a group. I usually get 3 or 4 individuals, okay? And once a week, we meet as a group, all of us. And then I will go over some different techniques, different relaxation techniques. We do essential oils. We do different pain creams. And we try different things because I'm never going to figure out what works for everybody. Not going to happen. Okay? But it's an 8-week program. I'll keep you on caseload for a little bit. We'll work on some different things. But then if you decide, hey, look, I just want to come to the group class, and that's fine. All right? So you learn how to control your brain, right? Does that make sense to everybody? Your brain is the epicenter. Your brain controls your pain. One of the biggest things, and I see this a lot, you see one person that comes in for a knee replacement, and then you see the next day you see a different person. Do you think they're going to perceive the pain the same? Not a chance. Some people will be up and walking the first day after a knee replacement. Some people will be 4 to 6 weeks before they even feel like moving. Okay? Because everybody perceives pain differently. So it's about reducing how your brain senses that pain. If you say, hey, look, this is what I'm going to deal with every day, and this is my normal, and this is how I can still do the things that I love, okay? You're going to have different pain scales. It's going to be a lot different. It's funny when I see different people and I say, well, what's your pain out of 10 today? They'll be like, 10. I'm like, okay, all right. And then you go to the next page, oh, like a 2 or 3. I'm like, oh, okay. So it's everybody's different. All right. So then we talk about pain medications, the best way to use them. And a lot of times I bring in Laura for this part of our program. And Laura can really get into those. Well, this pain medication is more for this. This pain medication is more for this. This one's long acting. This one's short acting. This one is, there's all different things. And that's why there's so many medications out there. All right. And then we learn about alternatives. Okay. Stress reduction is the number one alternative to pain management. Okay. Essential oils work pretty good. I've had people that have a lot of success with that. Sometimes just telling yourself today is going to be a good day makes a whole big difference. Okay. And then what we like to talk about, I have people fill out a form, and I want to know what's fun for you. Okay. So this program is not just, oh, here's this program, it's the same for everybody. It's not. It's okay, these are what is important to you. This is what you want to be able to get out of this and what you want to be able to do. All right, so it looks at a lot of different things. I think this is a video. I'm not sure if I'm going to be able to play it or not in this. Did it go away? It did. Yeah. I practiced this the other day and it worked.
Taking this course.
Nope. But for some reason it won't play when you're in presentation mode. So basically what it is we've launched this program about 2 years ago in every community. And this lady had a really good outcome. She always perceived her pain as way up here. And then after the 8 weeks, she's like, I still do the things that I love. So how can I be in a 8 out of 10 pain, but I'm still doing the things I love? And now I can do them better. So it really is a lot of perception. If you think you're miserable, you're going to be miserable. Okay, so that was the whole point of this video. And she's just saying, it really changed my mindset. And I tell people all the time, a lot of rehab is your mindset. You go have a major hip replacement or a knee replacement, and you come in and you lay there and you say, oh, I don't want to get out of bed. Well, it's my job to motivate you to get out of bed and say, hey, look, the more you move, the better you're going to feel. And nobody ever believes me when I say that. But then once you do and you're up and moving a little bit, you're like, oh, I do feel a little bit better. So that's kind of her point of her story. Just saying, I was a very big, I always had 8 out of 10 pain. And now it's probably more of a 2 or 3. All right? So what do you do next? Okay? You talk to me. Okay? You see me around. I'm all over the place. Or any of my staff. They're in and out and up and down and, busy. They're working. Call down and talk to us. I don't ever mind answering any questions for anybody. If you leave me a message, if I'm in a meeting, just leave me a message. I usually call you back within a day. Okay? Chat with a therapist. I'm going to start doing this probably in October. I'm just going to sit upstairs for about an hour. Ask me any questions you need to. Okay? We'll continue to perform Thrive screens on an individual basis. So if anybody ever says, hey, look, I'm feeling a little weak, I say, hey, well, let me come up to your apartment. We'll do a Thrive screen quick. And it takes about 15 minutes. All right? I'll bring all the tools with me. I'll bring a cart. We'll get one done. All right? Because it really shows you where you're at. And a lot of you I've done previously, and I can go back and say, hey, well, you scored a 14 last time. You scored a 13 this time. You're still in a pretty good range. All right? So you never know. Sometimes you feel different than you actually perform. All right, so the next seminar I'm going to do is I'm going to skip a couple because we're going to talk about the mind. So the next one will be September 30th at 11. So it's the last Wednesday of September, because we ran into a little conflict here and there. Okay? And it'll be the 30th at 11. I'll make sure the ad gets posted, hopefully before, a couple days before. And it's talking about what's called cognitive reserve. So myself and my OTs just went through this training with our corporate staff, where they kind of taught us everything, what the basis of this is. And it's working with people who are very sound in mind, okay? But you always want to sharpen it no matter what, right? Okay? They always say knowledge is power. So the more you know and the more you learn, the better you are off, okay? So that's what next month will be on, or the last one of this month will be on. And then we'll go back and do June's and July's and August's. I'm trying to keep it all straight there. All right? So I hope to see you all there. Remind everybody else to come. Anybody have any questions, comments? Yes, ma'am.
How can we strengthen our thighs in our apartment?
Oh, there's lots of ways. Do you have a TheraBand?
Yes.
Use that. I tell people you can put it around your legs. You can use your kitchen counter to hold on to. You can kick your legs out to the side, because a lot of times what people lack is the side muscles. Right? Most people have pretty strong quads, okay? But like I was saying before, you may have strong quads to stand up, but something to think about when you're doing, let's say you're doing squats. What I want you to focus on too is, okay, I want you to sit down and count to 10. Don't sit until you get to 10, okay? Nice and slow, okay? And I'll tell you what, after about 2, you're going to be like, oh my gosh. It's really tough, but that strengthens your quads in a different way, and it's harder, and that's how you gain the most strength. When we look at exercise, we call it in therapy world concentric and eccentric. Okay, concentric is shortening, okay? Eccentric is elongating. Okay, as I sit this way, these muscles are getting longer because they want to straighten my leg, okay? But it's actually harder to control, like even with doing bicep curls. This is pretty easy, but going down slowly is a lot harder, and it will build your muscle faster. Okay, so those are some secrets. Any other questions? Well, thank you all. I appreciate it. I'm glad you guys came. Thank you, Pastor Paul.
I always learn a lot listening to
Yeah.
myself.